Hello dear friends, how are you today? I hope you are well. Here we are going to explain another question about dermatology. A 17-year-old female presents with multiple comedones, pustules and papules on her face. Which one of the following is least likely to improve her condition? A. Topical retinoids. B. Dietary advice. C. Washing her face using a mild soap with lukewarm water twice a day. D. Oral trimethoprim. And E. Ethynyl estradiol with cyproterone acetate. Okay, here we have a 17-year-old female coming with multiple comedones, pustules and papules on her face. The diagnosis here is Acne vulgaris. The patient has acne vulgaris. Okay, topical retinoids is useful in patients with acne vulgaris. Okay, dietary advice has least effect on management over acne vulgaris. Washing her face using a mild soap with lukewarm water twice a day is useful in these patients. Oral trimethoprim is helpful, and ethynyl estradiol with cyproterone acetate is also useful in patients with acne vulgaris. Thus, the answer can be dietary advice. The dietary advice has no any crucial role in the management of patients coming with acne vulgaris. Okay, answer is dietary advice and explanation. Here we are going to explain it. There is no role for dietary modification in patients with acne vulgaris. Ethynyl estradiol with cyproterone acetate, or with a commercial name of Dianet, is useful in some female patients with acne unresponsive to standard treatment. Oral trimethoprim is useful in patients on long-term antibiotics who develop gram-negative folliculitis, and it's important if the patient is on long-term antibiotic and is developed gram-negative folliculitis. For the management, for the treatment, we can use oral trimethoprim. Okay, acne vulgaris management. Acne vulgaris is a common skin disorder which usually occurs in adolescence. It typically affects the face, neck, and upper trunk and is characterized by the obstruction of the pilosebaceous follicles with keratin plaques. Okay, because it's obstruction of the pilosebaceous follicles with keratin plaques, which results in comedones, inflammation, and pustules. Okay, here why washing face using a mild soap with lukewarm water twice a day can be helpful in these patients. Okay, acne may be classified into mild, moderate, or severe. Okay, mild acne, open and closed comedones with or without sparse inflammatory lesions. Moderate acne, widespread non-inflammatory lesions and numerous papules and pustules. And severe acne, we can see extensive inflammatory lesions which may include nodules, pitting, and scarring. As we can see here mild acne, and here we can see mild to moderate acne. Here we can see moderate to severe inflammatory acne, and here we can see severe papulonodular inflammatory acne. Okay, here we are going to explain it again. Mild acne, moderate acne, and severe acne. Mild acne, we can develop a few non-inflamed black hairs or white hairs less than 20, or a moderate number of mildly irritated pimples, as we can see here. This is mild acne. And moderate acne have more comedones and pimples, and sometimes larger, more inflamed pimples or pustules. And here we can see severe acne or deep cystic acne. Okay, have numerous large red painful pus-filled lumps or nodules that sometimes even join together under the skin into giant oozing abscesses. In severe acne, sometimes we have that pimples which join under the pustules, papules that sometimes join together under the skin, and they become giant oozing abscesses. We can see in patients sometimes coming with severe acne. Okay, a simple step up management scheme often used in the treatment of acne is as follow. Okay, single topical therapy like topical retinoids and benzoyl peroxide, and topical combination therapy like topical antibiotic and benzoyl peroxide and topical retinoid. Oral antibiotics, example oxytetracycline, doxycycline. Improvement may not be seen for 3 to 4 months, and this is important when after you using 1 to 2 months the patient, if he or she say that she or he is not seeing any improvement, we must say them that there is no any concern. They can see improvement after 3 to 4 months of receiving their treatment. Okay, minocycline is now considered less appropriate due to the possibility of irreversible pigmentation, and this is important when we are prescribing minocycline in a patient with acne. We must think about its side effect like irreversible pigmentation. We must think about it. Does it cause or not? Does the prescription, does it have benefit or not? Thus we must think about its benefit, because irreversible pigmentation is side effect of minocycline. Okay, gram-negative folliculitis may occur as a complication of long-term antibiotic use. Okay, we must be careful about this. Also, high-dose oral trimethoprim is effective in if this occurs, if the patient is receiving long-term antibiotic and gram-negative folliculitis is developed in the patient, then we can use high-dose oral trimethoprim for preventing or treating the gram-negative folliculitis. Okay, oral isotretinoin only under specialist supervision is indicated. Okay, if you are going to prescribe oral isotretinoin, it must be only under specialist supervision. Okay, but here is a point: there is no role for dietary modification in patients with acne. There are lots of patients coming and asking if the dietary regimen has any effect on their preventing or promoting their acne which they have. But the answer is no. There is no role for dietary modification in patients with acne. Okay, here was a short explanation about management, treatment, presentation, and different types of acne vulgaris. Thank you for your attention.